Welcome to the MamasteFit Podcast. In this episode, we have someone coming on the podcast to share their birth story. In her first birth, she had a C-section, which was unplanned, so she labored, made it all the way to 10 centimeters, and then had to have a C-section because she was starting to get sick and her baby's heart rate was very elevated. She spent a lot of time processing that birth and then was preparing for a VBAC for her second birth, but then baby was breech her entire pregnancy, and then the day of her C-section, baby was head down. And so in this episode, Destiny is going to be sharing her C-section birth story and her VBAC birth story. Welcome to the MamasteFit Podcast. My name is Gina. I'm a perinatal fitness trainer and birth doula.
And I'm Roxanne, a certified nurse midwife.
And this is the MamasteFit Podcast, where we empower you on your pregnancy, birth, and postpartum journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable because pain is not a requirement of pregnancy. Understand the science of birth and approach recovery after birth.
We share our personal experience navigating motherhood and our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum recovery.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast. We have Destiny here who's going to be sharing her two birth stories. Her first birth was a C-section and then her second was a VBAC. So thanks so much for being here, Destiny.
Thank you for having me.
So let's start with your first birth. How did you prepare for that birth?
Well, I would say the extent of my preparation was working out. I did the best that I could as far as maintaining my exercise regimen. I was really into strength training at the time. I attempted to continue running, but I found it really, really difficult with just pelvic floor issues. It just became really uncomfortable, probably 20 weeks up. But that was probably the extent. I mean, I watched a lot of birth videos. But I think I just kind of went into it like a little ignorant, thinking like, oh, I'm fit, I'm healthy, like this will just be fine. It'll just kind of work out. And it did not. So, well, it did not go as planned, at least.
Yeah, I think that's pretty standard for most of us for our first. You don't know what you don't know when you're going into it. So let's get into your birth story then. So you went through your pregnancy fairly active. You were listening and watching other birth stories. What was the end of your pregnancy like? And then we'll get into your birth story.
Yeah, I would say with my first pregnancy, the end was, just like it is for everyone, it just gets uncomfortable. That being said, I worked out until the day I went into labor. So I certainly had some privilege in that and having the availability to do so. And then also mobility. But yeah, I just felt really uncomfortable. I had it in my head that, you know what? Oh, I'll try to go unmedicated for as long as possible, but did no preparation, which is really funny because I watched all these birth stories that said you should prepare for it. And I was just like, oh, fine. I work out, we're good. And obviously that did not pan out, but as we'll get into. So that was the end. I had a pretty run-of-the-mill pregnancy, no major complications. I failed my first glucose test, which really messed with my head initially, but then I passed the 3-hour and it was fine. Gained the recommended amount of weight. It was just a pretty standard, I think many people probably call easy pregnancy.
So then let's get into the birth. So smooth pregnancy, nothing really cued you in that your birth may not go quite as smoothly. So let's get into it.
Yeah. So, okay. So I originally wanted to go in for induction, and I hit 39 weeks. I was going to go in for an induction, because my husband's in the military and he had some training that was coming up very shortly after. So I was like, we have a deadline here. We need to have this baby. And so we had scheduled this induction and it kept getting pushed. It didn't end up being needed. I went into labor naturally at, I think 39 weeks exactly, or maybe 39 plus 1. And labor contractions started at 8 p.m. on a Friday. And they were not painful. just kind of, I felt like tightening, and I hadn't had any Braxton Hicks or anything like that before that. So I kind of figured this was labor because it was fairly regular tightening of the abdomen, but not uncomfortable. And then, let's see, I took notes. So of the timeline, around like 2 a.m. is when I started to feel some discomfort. And for some additional context here, I was being seen at a military hospital that had somewhat limited, I don't know if you'd call it like L&D space. And so when I called around like 3 a.m., called triage to just be like, hey, should I come in? And they were like, oh, you can mosey your way over here. And because the induction had gotten pushed, because they just kept on having, people were actually going into labor, and so they were running out of space, I felt this like pressure to kind of rush to the hospital and claim my space. Because they were like, oh, if we don't have space, we're going to divert you to like any of the other local hospitals. And we were in the DC area. And so it was like, that could be literally anywhere. And that really freaked me out. And I wanted to be seen at that hospital. If I can go back in time, I would change that. But so we got there. Let's see, I think we went in around 4:30 a.m. So when I started to feel like, okay, contractions were pretty regular. I had one of those like little apps, and the app just kept saying like, you should go to the hospital, because my contractions were fairly close together, although they were like still manageable. We get to triage. They're like, yep, you're in labor. I'm 4 centimeters. Contractions were fairly regular. And they were like, do you want to go home or do you want to stay? And this is where, if I could go back in time, I would have just went home. And I've come to realize now that, like, honestly, the hospital probably didn't matter at the end of the day. But I decided to stay so that I could, like I said, kind of claim my space, because they had room. They said this too. They were like, you can go home, but like there might not be space in a few hours. And so I was like, okay, well, I should just go ahead and be admitted. What I didn't know is that when I got admitted, they were also going to require me to have continuous fetal monitoring, which I found to be very uncomfortable. They didn't have any like wireless monitoring or anything like that. And so I felt like pretty tethered to the bed. Like I really could not move around. And so I had it in my head that like I had heard all these stories online, movement kind of gets things going. And then also it's like how you cope with some of the pain. And I felt very tethered to the bed, could not really move, because they had me like, I had IV drip. I had these monitors with like kind of like short wires. And so I was like, you know what, screw it. I should just get the epidural. And around like, what was it? I think I put 10 a.m. contractions got very painful. And I had heard all these stories that contractions were like waves and you get a break. And I felt like I had no break. My contractions were like back to back. It felt like as soon as it came down, it was coming back up. And so I was just like, this is unbearable. I can't move. I'm like in a lot of pain. Let's just get the epidural. And after that, I did get the epidural around like 10 a.m. and I was 6 centimeters. And I felt like after that, it really, really slowed down. Maybe this doesn't happen for everyone. I heard from some people that like the epidural actually sped things up for them because they were able to relax. That was not the case for me. Things got really, really slow after that. I felt like I was progressing like 8 p.m. to 10 a.m. I was already at 6 centimeters. Like I felt like that was fairly quick for a first-time mom. And after that, I did not progress for a while. I think, I didn't reach 8 centimeters until around 3 or 4 p.m. So like from 10 a.m. to almost dinner time, I only progressed 2 centimeters. And then they were like, let's try Pitocin. And they gave me about 20 minutes of Pitocin, but my contractions were so regular already that it just made them even closer together. And they were like kind of freaked out about that. So I did 20 minutes of Pitocin and they quit that. And then, I think we did a ROM. We ruptured membranes somewhere in the afternoon. But it just took a while, a lot longer than I expected. But I got to rest, I got to take my nap, I ate my popsicles. And then I got to 10 centimeters around like 11 p.m. ish. This is like 2 years ago. So there's definitely some fogginess as far as timing goes. But around 11 p.m., I get to 10 centimeters. And then they're like, well, the doctor's in a C-section right now, so let's just wait until the doctor finishes. So we wait a little while. Doctor comes in, and I don't love this physician. It's I know you guys are like military as well, so I'm sure you're familiar with, like, I didn't have like an assigned doctor. It was like a rotating door of doctors that I saw, and I didn't know this person and didn't love her bedside manner. She was just kind of stern. But so she comes in and she's kind of trying to coach me. Some of the nurses are trying to coach me through pushing. I felt like I could still feel my contractions, so I was able to time my pushes myself, but I don't know that my pushes were very efficient with the epidural. And they kind of implied that as well. They were like, "You're gonna have to push harder," and like one of the nurses or doctors were like, "You need to get angry, like you need to push harder." And I like started to feel almost, I don't know, bad, like I wasn't good at this. Thankfully, my husband's super supportive and he helped a lot. I kind of ended up relying on him and one of the nurses. I ended up kicking or asking everyone to leave so that one of the nurses I liked and my husband could help me. And she did all kinds of different like tug of war and like grabbing different things to like help me push more efficiently. But basically in the pushing stage, I ended up spiking a fever and a really low grade fever, but they were worried about, I'm going to butcher the pronunciation of chorioamnitis, that infection. They're worried about that. And then my daughter also, she had sustained a pretty high heart rate the entire time during the pushing, that the doctor started to get a little alarmed about that. And then she also never got past station 0. So I pushed for about an hour and a half, and the doctor started being like, we might need to consider a C-section because of these list of issues. And that was really hard for me because I really had it in my head that like, I don't know, I'm healthy, I'm fit. Like, I feel like I did all the right things, and it just wasn't working out. And I also felt very confused. Like maybe there wasn't a great explanation for the C-section. Thankfully, my physicians on the other side with my son actually clarified some of that and helped. But they ended up saying that, like in my record, they called it arrest of descent, which maybe you guys could touch more on this, but I've had a doctor tell me that makes sense because my daughter never got past station 0, pushing for an hour and a half. And I've had another doctor say, you should push for 4 hours before they said arrest of descent.
Yeah. Yeah, I would say like with an epidural, it can take like an hour or two just to figure it out. Like it's a new sensation. You have to kind of reconnect like your mind-body connection with not feeling the lower half of your body. So it could take somebody just an hour to 2 just to even figure out what is going on. It sounds, based on what you've told me, more that you were starting to get sick and your baby was starting to show signs that they were also maybe starting to get sick. And that's why they may have recommended a C-section. And I don't know if it was necessarily because like your baby was not moving down, because it can just take time to figure it out also. It doesn't sound like you had enough time to really explore that with an epidural.
Yeah, but them putting that in my file really bothered me, because if you tell any physician and you want to be a VBAC that you had arrest of descent, that's like this kind of sign in their calculator that the VBAC is going to be, lower chance of success. So that kind of bothered me. Like, we'll get into it, but fortunately with my second labor, I had very supportive physicians that were like eager, like gung ho, like, yes, you should Tolac. But basically somewhere in there, they recommended a C-section. And at first my husband was a medical student at the time, and he pushed back against it and was like, oh no, give her some more time to push. But then with really what convinced him, and then by proxy convinced me, was my daughter's heart rate issues. So we did the C-section, and I found it to be truly an awful experience. I don't know if like a planned C-section is maybe a little better, but having gone through the whole labor process and then a C-section, like I was vomiting I was very emotional about the C-section and like what I perceived to be the failed labor. And it was just, yeah, really, really did not enjoy it and did not want to repeat it. I was like telling my husband during the C-section, if I have to do this again, we should do general anesthesia because this is so bad. Like I hate it. But all things considered, I had a very, very good recovery from what I've heard from like other C-section moms and compared. I was up and moving very quickly. I was back to working out very quickly. Breastfeeding was no issue. So all things considered, the postpartum side of things were pretty good. I had pretty bad postpartum anxiety, which I think maybe has to do with the fact that the birth went so unplanned. But that was, yeah. So that was the story with my daughter. And that was back in 2024.
So then how did your first pregnancy and birth impact your preparation for your second one? Because you just had another baby very recently.
Yes, just almost 3 weeks ago. So, well, I, with my son, I really wanted to Tolac. That being said, it also gave me a lot of anxiety because it felt like this unknown. And there was a part of me that was like, can I push a baby out? Like, am I built for birth? Like a lot of people say. And so there was a lot of anxiety about it, but eventually the anxiety of it was kind of taken out of my control because my son was breech for probably from like 25 weeks until the day I went in for my C-section. So I, around like 36 weeks, my doctor offered a ECV at 37 weeks. I went in for the ECV and there was like this freak accident that day at the hospital that resulted in the OR being closed. So my ECV needed to be rescheduled, but with childcare and stuff like that, that was just not feasible. So I was like, all right, well, I guess that didn't work out. Part of me was like taking it almost as like a sign from the universe that I just need to like let go of this VBAC dream. I did try like some spinning baby stuff and some of the stuff that you guys had posted about breech, like in the inversions and stuff like that. I didn't go see a chiropractor or anything more intense, but was doing a bunch of movements to try to get him to flip. And I got really discouraged because every appointment I went to, they would do an ultrasound and he was just, and I could feel him too. Like I could feel his head right here. I mean, he was not budging. He was very comfortable. So when we went in for my C-section at like 6:30 a.m., and my doctor was like, oh, well, let's just do an ultrasound and check. I was just like, oh, he's still breech. Like there's no point. And she was like, well, let's just check. And he's head down. I was like, the only word that comes to mind is like flabbergasted. Like, I'm just like, what? That makes no sense. He has been breeched this entire time and no movement. I mean, he was breeched the week prior at my 38-week appointment. So I was very shocked. And so, sorry, to answer your question about preparation. Not much, once again, because he was breech and I was like, I'm just trying to get this kid to flip. And so I was like, didn't have really much hope that I was going to get to have a vaginal delivery in the first place. I was much less active this time, trying to chase a toddler. And my husband is a resident. And so his schedule was really busy. And so it was just like working out didn't really happen much. So, yeah, that answer, sorry, that's a long-winded answer to your question that I didn't really prepare again.
No, it's totally fine. So a baby's breech and you've like surrendered to the birth that you believe that you're going to have. And now he's head down.
Yeah.
So what next? What happens next?
Yeah. So my doctor is like, she doesn't even ask. She's like, all right, so Tolac. And I was like, okay, well, yeah, I guess I could do that. Like, I'm just like, taking it all in, kind of digesting the like, oh, and then also digesting the fact that I did not do anything to prepare for this. Like, this whole time I thought I was having to like mentally and emotionally prepare for this like horrible C-section experience again. Like, that's what I'd had in my head was like, okay, I got to like focus on just getting through this C-section. No. So doctor's like, oh yeah, so do you want to just go ahead and do an induction? Because he's head down. And like at this point, we're like, he's unstable lie. Like he could flip again, I guess. So like, do you want to just go ahead and induce? And I was like, yeah, let's just do it. I'm here. I have childcare in town for my daughter. Like, let's just do it. And then come to find out, I'm already kind of in labor. They were like, oh, you're having contractions right now. I don't feel them. And I'm 3 centimeters dilated already. And so they were like, it was just like this wild, I don't know. I didn't expect any of it. I thought that maybe because he was breech, I wouldn't dilate like I did with my daughter. Because with my daughter, I was 3 centimeters from like 37 weeks on. So it was just a very surprising morning. But by like 9:30 a.m., they started Pitocin, and quickly realized, kind of with my daughter, the same thing. Like I'm very, very responsive to Pitocin, I guess. So I was never able to go over, I guess it's like dose 3 or I don't know what like the measurements are, but like level 3, they could never put me over that. They were constantly having to lower it because my contractions were so close together. And they were concerned about uterine rupture, like, or what is it, uterine dehiscence or something like that. Like they were just concerned with me also being a VBAC person. Like they didn't want to put too much stress on baby or the uterus. Sorry, I was just leaping straight into the birth story. Did you have another question?
Just go into it.
Okay.
Just go into it.
Yeah. So, that morning, we start Pitocin 9:30, and then the doctor wants to do cervical checks like every 4 to 5 hours, which I was fine with. They don't really bother me. It's more like I actually kind of want the update to know how things are going. It was also a training hospital, and so there were like more people involved than maybe I would have liked. We did eventually, I think by the second check, we were like, okay, no, not, because I was having 2 people check me each time. So it was just like, I did that twice. And then I was like, okay, we're not doing that anymore. And thankfully my nurse and my husband were also just like, no, this is too much. We don't need to have 2 people checking her every single time. Not that it was super necessary because I only had 1 more check before I had the baby, but
yeah, but still, that's a lot. Oh, no, thank you.
no, it was a lot. So let's see, we started the Pitocin at 9:30, and I mean, literally 30 minutes later, the nurse came in and was like, we have to lower your Pitocin because your contractions are so close together. I couldn't feel them at all at this point. She was like, do you have high pain tolerance? And I was like, no, not really. I'm probably pretty normal here, but I just can't feel it. And then they come check me again at like noon, and I'd progressed 1 centimeter, a little bit of effacement, no change to station. I was still at like station -2 or something like that. So I was getting a little discouraged. In my head, I was just like, if we make it past station 0, I will feel like this has like a chance, because it's just, I was comparing it to my daughter. Like I just have to make it past station 0 and I will feel like we're good. But the whole time I was doing all of these movements. So I was like watching you guys' videos on like the hip opening stuff. Cause I was like, really had it in my head, like, okay, I'm doing this. I need to make sure it works. Cause it didn't work with my daughter. Like she would not come out, whether it was because of insufficient pushing or like poor positioning or something like that. Like that was the other thing with me having the epidural so early in the labor process. I kind of was thinking maybe my daughter was in a bad position, because she also came out with bruising along her forehead. And so I was thinking maybe just her head wasn't tucked or something. So I was watching all these videos you guys had about hip opening and the, how to open the inlet versus the outlet. And it was very interesting for me to hear like what is station -2 versus 0 versus +2, and like what you need to be doing at those different stages. And so that's what I was doing. So that's the other reason why I liked the actual cervical checks, is because I was like, okay, I need to know what movements I need to be doing.
Yeah.
But because I couldn't really feel my contractions, I was moving the whole time. And this being my second birth, my husband being like, he's like, an actual physician now. And so like I feel like both of us had a lot more confidence asking questions and being a little bit more pushy this time. I think maybe pushy is the wrong word, but it's just the word that comes to mind. But like, I like asked for wireless monitors this time and really like pushed for them if they had them available, and they did. So I was able to like really walk around. anytime something was uncomfortable, like we spoke up and like had it changed. And so things were just so much better. Plus, honestly, the nurses at this hospital and my physicians were really incredible and super supportive. I had nurses come in and be like, "Oh, I see that you're doing all these movements, but do you want like to try something that we recommend?" And I was like, "Yes, please." Like, so one of the nurses put me in, I think you guys have talked about it in one of your videos, the flying cowgirl or something like that.
Mm-hmm.
Like, so put me in that, which was not super comfortable, for like 20 minutes on each side. And we were just doing all kinds of movements. And so anyway, let's see, my next check was around like 5:30 and I progressed to station 0. I had still only progressed to like 5 centimeters, but 80% effacement. So we were making progress. It was slower than I wanted, but we were making progress. And at 5:30, I could feel my contractions, but they were still not super uncomfortable. I could just feel them. And I kept telling my husband, I was like, I feel like pain is gain here. And so like, I'm not moving very fast because I can't feel this. Like I almost was like wanting it to get painful because it would feel like I was making progress. And so I was like, man, I was like telling the nurse, I was like, we get up to Pitocin. Like, we're good. I'm fine. And she was like, well, we actually can't. Like, I mean, like I said, we never went over level 3. I was like bouncing between 1 and 2 the whole time because they were just like, your contractions are so close together. And I told you it was like a whole team of doctors because it's a teaching hospital. And they're like, you sure you don't have a high pain tolerance? Like, you really don't feel it. But man, was I in for a rude awakening because an hour later things shifted very quickly. So got checked at 5:30, and then around 6:30, I was like, okay, things are kind of painful. Like I need to I'm definitely thinking about the contractions a bit more. And kind of like with my daughter, my contractions were pretty close together. Partly, I'm sure, also because I was on Pitocin. But oh yeah, and at that 5:30 p.m. Cervical check, the doctor brought up artificial rupture of membranes, and both my husband and I were just like, no, let's just like not mess with this process. Things are progressing, albeit feels kind of slow, but things are progressing, and we were just kind of trying to keep it as like, I guess, low intervention as possible. And the doctor was like super supportive of that. She was like, yeah, things are going well. We don't want to put a 24-hour clock on this, so like let's just keep on keeping on. Which was really nice, because I thought with my daughter, it really did feel like when someone came in with a question, it was more like a statement. It was like, oh, this is what you should do versus like it being a question or like a collaborative decision. So we didn't do that. And then let's see, around like 7 p.m., contractions are getting pretty uncomfortable. And I remember telling myself like, okay, let's just make it to 8 and then we'll evaluate the epidural. And I also had this conversation with my husband. I was like, okay, we'll probably get the epidural eventually, partly because my doctors, yes, they were super supportive of Tolac, but they were pretty nervous about me going fully unmedicated just in case if there was like a medical emergency where I needed a C-section. So no one ever pushed it, but they just did kind of say like, we would prefer it if you got an epidural at some point. But after that first conversation, they never brought it up again. So they weren't pushy. They just kind of expressed like their preference and then left it, which was kind of nice. But yeah, around 7 p.m., I'm talking to my husband. I'm like, okay, I'll make it to 8 and then let's talk about the epidural. And he was like, I think you're good. He was like, you know what? You should just keep walking. Like, you're doing well. I don't know if you need the epidural. And part of this is like, he's like joking with me. And the other part of it was like him actually, we both felt like the epidural just really slowed things down last time and things were moving. So we were just like, let's, avoid it if we can. And then 8 p.m. comes around, and I'm assuming this is when I go into transition because I'm in excruciating pain. Like just suddenly, it was like I had two more contractions where it felt like, okay, I can manage this, but it hurts. And then it was like, oh my gosh, I'm like laying on the bed, writhing in pain and begging for the epidural, telling my husband I can't do this. I told him I was like, I don't want a baby anymore. Like he was like, I think it's a little late for that. I was like, I'm in a lot of pain. And then this is where things get really foggy for me. But just to kind of give you a little bit of foreshadowing, my baby was born 30 minutes later. My water breaks. very suddenly while I'm in that, like telling my husband I can't do this. At some point I did ask the nurse for the epidural and she left to go get the anesthesiologist. But by the time the next nurse came in, my water had broken and I was pushing. Like it was totally involuntary. So a nurse comes in, she's like, "Hey, we're going to get the anesthesiologist." And I was like, "My water broke, I'm pushing." And I'm like, I'm yelling at this point, have lost total control of anything that comes out of my mouth. No sense of decorum, nothing. It's just like crazy. And so she rushes out, and then suddenly, it's a teaching hospital. I think what happened was like my doctors were like maybe somewhere else in, I don't know, it's called ward or something like that. And so like they're further away. So she just grabbed like the first OBGYN that she saw. And so like, then it was like a flood of people came in because they were like, "Oh my gosh, this like Tolac, second time mom is like pushing." Like, so then there's like just a bunch of people rushed in, and my nurse finally comes in because that was also like a random nurse my husband had grabbed and told her. They rush in, and then it was very overwhelming at that point. If this is where I would change things, I would have like said up front that I wanted less people in the room. Granted, after I kind of got a hold of things, I didn't even realize there were many people in the room because like my eyes were closed and I was just like so focused on pushing. But at first it was very overwhelming because I just wasn't expecting this. It just happened all very quickly, and I'm pushing. It's obviously very painful. And there's like a million people in the room. I mean, and I don't think like some of the doctors maybe realized that I was unmedicated when didn't have the epidural. Because when they come in, they're like introducing themselves. Like one of them was like, "Hi, I'm Dr. So-and-so." And I remember being like, "I do not care. Like I am pushing a baby out. Please stop talking to me." And so, it was very chaotic. And I had like so many people talking to me. Like one person was like, "Do you want to push on your hands and knees?" The other person was like, "Do you want to push like this?" And like, I think there was maybe some people that were like excited to see an unmedicated labor or something. I don't know, like, because I was laying on my side. And so maybe they assumed that I didn't want to be on my back. But at the time, that actually felt the most comfortable. So I ended up pushing like on my side with my leg up. But if I could go back in time, I would have one doctor, one nurse, and my husband. Because like that nurse helped a lot. And it was my husband too. It was like, I just needed two people to help me coordinate my breathing. Because that's the other thing, is because it happened so quickly, it felt very uncoordinated at first. There was like no control over what was happening to me. So I was like, my breathing, my pushes were not happening with my contractions. I was just like very like confused, I guess. But once I got a hold of it, the nurse was telling me, but she said, "Push into the pain." And that like clicked in my brain. I don't know. It just helped. And then my husband was telling me like, which pushes were good and which ones were not. Cause I was going through different, like, do I breathe through the pushes? Then there's like purple pushing, or, I was like pushing with like holding my breath, and wanted to know which one was more efficient. But he told me, I don't know, I was like out of it at the time, but he told me it only took like 15 minutes from the time that I started pushing until baby boy came out. So yeah, it was like felt like a whirlwind. And I would just remember feeling relieved when it was over. I don't feel like I had like the golden hour experience some people describe. I was just like happy that I was no longer pregnant and pushing.
Yeah. Well, sometimes it's harder when you have an unexpected fast labor to like, you need like a moment to recover from what just happened as well.
Yeah. I felt like exactly. Like I was just like, what just happened?
So how was postpartum after this birth?
Oh my God, so much better.
Or how has it been? It's only been 3 weeks. So
leagues better. And I said, like I said, my C-section recovery was, I would say, like as good as it gets for a C-section. And this was really so much better. And it really, really set in stone for me. One of my driving forces for wanting a VBAC was my toddler. I wanted to be able to hug my toddler and pick her up and interact with her. And I was really, really nervous because I remember any use of your abs after a C-section is so painful. Putting my daughter in the bassinet after the C-section was painful. Getting out of bed was painful. So I was just like, really, really wanted what everyone says that vaginal delivery recovery is better. And so I really wanted that so that I could pick up my daughter and stuff like that. And it's true, at least in my personal experience. I had a 2nd-degree tear, so nothing crazy, but it kind of hurts, but nothing compared to a C-section. It has been so much better. My daughter came to visit me in the hospital, and I was able to pick her up right then and there. It was awesome.
Oh, that's awesome. So what advice do you have for somebody let's start with somebody who is finding themselves with an unplanned cesarean birth. Like they did all the right things and they're finding that their birth is not going in the direction that they hope. Like what advice would you give to that person that's kind of recovering from that unexpected birth?
I would say the thing that helped me most was truly understanding the reason for the C-section, assuming it was warranted. Because I felt like so much of what affected me negatively mentally was just not understanding why. I really felt like I needed to understand why. And then once you understand the purpose, hopefully it was justified. I feel like it's just easier to cope with that because it's easier for you to be like, okay, well, it wasn't my fault. Or it wasn't that I am not equipped for this or something. Especially when it's something like heart rate issues, like you can't control that.
Yeah. Who did you discuss with to better understand why your C-section happened?
Honestly, my OBGYN with my son, my pregnancy with my son.
Okay.
Because in discussing the want for a VBAC, there was discussion of what caused the C-section originally.
Okay, that'll be helpful for folks that are listening. What advice do you have for somebody that was maybe planning a VBAC and then realized that they were going to have a planned C-section instead? Because you went through that process as well of accepting that. What advice would you give to that person?
Oh man, I don't know if I have great words of wisdom because I don't feel like I ever. I cried on the way to my C-section, so I don't know if I ever really truly accepted it. The best advice is just having a good support system. I just really hope that person has a really good partner that can talk them through their anxieties and fears around the C-section, assuming that was my reason for not wanting a C-section. I just really truly found it to be an inherently traumatic experience. And so going into that again was really scary. And it was helpful for me to have my husband talk me through it and, reassure me that he was going to be there, there with me through the whole process and would advocate for me if there were things that were making me uncomfortable that were changeable. That's pretty much the extent of that. I'm a therapist, so I will always also push therapy. If it is accessible to you, getting a good therapist.
Absolutely. And I don't think there needs to be this deep acceptance. I think sometimes even just validating that this is also a hard experience is helpful for our listeners as well. And then the final advice, what would you tell somebody who just had a really fast, unexpected labor, as they are kind of processing what happened? Do you have any tips?
So I would say on the front end, I would say pretty much everyone should probably look at how to endure unmedicated labor, just in case. Because I've heard this is not an uncommon story where people think they're going to get the epidural and then things move really quickly and they don't get it or the epidural doesn't work or something like that. So just looking at some things you can do, whether that's movements or just practicing coordinating your breaths with pushes and stuff like that. I don't know. So on the front end, I would say just baseline, do some at least preliminary research on how do you endure unmedicated labor. And then honestly, the biggest thing that I would change from my entire experience is limiting the amount of people in the room especially when it's already very overwhelming. So maybe discussing with your support person ahead of time, like if that were to happen, these are the people I want in the room because I'm already going to be overwhelmed. We can assume that. So I need you to like kick all these people out. Because that was really the overwhelming part for me was like I'm like freaking out and also having all these questions directed at me.
Yeah, that was something during my first birth that I gave birth in a hospital, and there was like 15 people in the room. And at one point I looked at my nurse and I was like, who are all these people? And she kind of like was pointing to each one. And then in Roxanne's third birth, there was change of shifts. So they had day shift and night shift and a bunch. And she was like, in hindsight, it was a little overwhelming with like the number of people staring at my butthole. And I was like, yeah, it does. Like you don't always notice it because sometimes your eyes are closed. But when you do realize it, it can be really, really overwhelming. So that's really great advice to advocate for less people. I think that would be super helpful. And to know who somebody would want in the room so that they can be very specific on who they request. Yeah,
I think one other thing I would probably say, because I wasn't expecting this at all, is getting sutures after unmedicated labor is really painful, even with local anesthesia. At least it was for me. And I, once again, like, my husband's a physician, so like I generally like to be supportive of the learning setting. Like I am generally okay with being the guinea pig. This was not the time to be the guinea pig. There was an intern being trained and my sutures took 45 minutes. It was really, really awful. If I go back in time, I would have said no to that and would have requested a fully board certified OBGYN to just come in and knock that out really quick.
Oh my God. Yeah. No, thank you. Oh my gosh. No. Oh, that sounds awful. I'm so sorry.
It was pretty terrible. I mean, like, I don't want to make the guy feel bad. Hopefully he doesn't watch this. Like, but yeah, it was not.
But I think it's a little bit of an awareness thing too. Like there's other patients on the floor who I'm sure have epidurals that could have been a better candidate for like a learning experience, like if they wanted to be that versus somebody who is unmedicated, like that's a lot. Yeah. Oh gosh.
Yeah.
Oh gosh.
Because I didn't realize that like every time they even just touch you down there after you push a baby out hurts.
Yes.
Like not even just with a needle, just even with their hands, it hurts. So yeah.
Whew. Oh my goodness. Well, thank you so much for sharing your birth stories. Do you have any other advice that you want to share with our listeners that are preparing for their births, maybe navigating their postpartums as well?
No, I think we pretty much covered it all.
All right. Well, thank you so much, Destiny, for coming on the podcast and sharing your birth stories. We really appreciate your time.
Yeah, thanks for having me. I was excited to share this, what felt like super crazy story. So.
My name is Danielle, and I'm grateful for the MamasteFit postnatal programming because it helped me heal my body and mind after both of my pregnancies. I was able to come back stronger than ever before, and I really love how they build up from the basic building blocks all the way up to personal records.
Thank you so much for listening to Destiny's Birth Story. If you want more support from us throughout your pregnancy, check out our online prenatal fitness programs. We offer them in 2 different formats. We have a self-paced version, which is going to be a list of exercise with demo videos, where this is going to be more our strength training program. And then we also have a video-based program where it's videos that you work out with and follow along with at the same time. So depending on your workout preference, we have 2 different options for you. We also have our childbirth education course, which is going to help you to understand what all of your options are for birth. There's no one best way to do anything during pregnancy, birth, or even into motherhood. And we want you to help you understand what your options are so you can choose what works best for you and your family. And then in the postpartum, we do have our postpartum fitness courses as well to help you feel strong again in motherhood, both with a self-paced version and a video-based option as well. You can check out all of our courses and fitness programs on our website at mamastefit.com and use code STORY10 to get 10% off any of our online offerings.